Days back, I happened upon an article that was published on the 15th of July 2021. We're talking about as recently as this month. The news article said that for the first time in medical history, neurosurgeons at the University of California, San Francisco, have been able to harness the brain waves of a paralyzed man, unable to speak, and translated what he intended to say into sentences on a computer screen. This is a perfect illustration of the power of the branch of medicine called neurology. It did say that it would take years of additional research before the technology becomes routinely available, but the fact that the experiment was successful in the first place, it's a miracle in itself. Did you know that the first Black neurosurgeon anywhere in the world was a Nigerian? His name was Professor Lalikon Odekun. He became a neurosurgeon in 1962 after training in the United States. Unfortunately, years later, the growth and development of neurosurgery in Nigeria has been really slow. In fact, we can say that neurosurgery is an endangered species in medicine in Nigeria. Now, let me blow your minds. Do you know that we have less than 100 neurosurgeons catering to a population of over 200 million people? I am worried. You should be worried. We all should be worried. Why? Do you drive? Do you make use of road transportation? Do you know that road accidents are the highest causes of brain and spinal cord injuries? According to statistics from Federal Road Safety Commission, Nigeria loses 4 persons every 6 hours to road accidents. We're talking about a mind-blowing 16 persons daily. In other words, you and I were just a drive away from a brain or spinal cord injury. With less than 100 neurosurgeons in Nigeria, do the mathematics. The answer you get is the reason why having a brain or spinal cord injury in this country is a death or near-death sentence. Our guest today is Dr. Charles Ugo Ugwuanyi, a chief consultant neurosurgeon at National Hospital Abuja and the Wellington Neurosurgery Center with over 15 years of practice in the field of neurosurgery. We'll be discussing the factors impeding the growth and development of neurosurgery in Nigeria. My name is Ekwi Onyekwele, and this is the White Coat Report. You're welcome, Dr. Charles.
Thank you, Ekwi. I'm happy to be here.
I'm happy that you honored our visit, sir.
Thank you.
Okay. Earlier on, I did say that we have less than 100 neurosurgeons in Nigeria. To set the record straight, how many neurosurgeons do we have presently in this country?
Okay, thank you, Ekwi. You've already introduced me.
Yes.
So let's just go straight to the business of the day. She has made it very clear, unequivocally clear, that a country with a population of 200 million people has less than 100 neurosurgeons to look after this population. And as a matter of fact, the population is expanding. So the current data is way above that.
Yes, yes.
The 100 you're talking about, we need to look at the actual number that are really working. As you are aware, the greatest danger we have right now is that you're not sure of your numbers any day. I'm not sure the numbers on paper are actually the numbers that are on the ground. As you are aware, doctors are living every day for greener pastures. So the real problem is we need to really define how many of those numbers are actually on the ground. And I can bet you that functionally on the ground, they are not up to 100.
So we're talking about those that have left the country, those that must have died?
Mostly those who have left the country for greener pastures.
Okay.
There are a lot of forces that are driving the younger surgeons to leave the country. Not only neurosurgeons, other specialties, and of course, younger doctors who have not even done the specialist training. So, the meager resources that we have in the country have been invested to train doctors, train other specialists, but the country is not harnessing the benefits of those investments because these young doctors are living by the second. In fact, it has been considered a pandemic, the mass exodus of doctors in Nigeria, not only in neurology or neurosurgery, other specialties. Let's say, for instance, cardiothoracic surgery. We produce cardiothoracic surgeons every day, but their situation is even worse than neurosurgery.
Wow.
Yes, because functionally in Nigeria today, I'm not sure we can count more than 20 functional cardiothoracic surgeons. So talking about neurosurgery with up to 100, it's better than some specialties like cardiothoracic surgery and other rare specialties. In fact, anesthesia is worse hit because anesthetists that are trained here, they cannot stay because they have better job offers, better incentives outside the shores of this country. And of course, we're talking of a surgeon. A surgeon cannot function in isolation. A neurosurgeon cannot function without an anesthetist. A cardiothoracic surgeon cannot function without an anesthetist. So the same mass exodus of doctors is hitting all the specialties in this country. So even if we have 200 neurosurgeons and they can't function, it's as good as nothing. So let's look at real figures, and the real figures are the ones that are functionally active.
So we have
way situation than we imagine.
Yes. So the figure is really way less than 100.
Absolutely.
Yes.
And then let me take it a little bit further. Now, talking of these high-end specialties like brain spine surgery, cardiac surgery, kidney transplant, hardcore orthopedic surgery, the real issue with these high-end surgeries, is that the equipment that are needed to practice them up to acceptable, minimally acceptable
international standard,
they are concentrated in a few centers in this city. Therefore, it will be unrealistic to expect some levels of these high-end operations to happen outside the cities. The equipment are very expensive. They're only affordable by government hospitals, those of them that are classified as tertiary institutions that are able to fund this equipment from the budget. That's where you find these equipment.
How many FMCs actually offer residency in neurosurgery in Nigeria?
Yes, talking about training of resident doctors, let me just go back a little bit.
Okay.
From your opening remarks, you truly recognize the founding father of neurosurgery in Nigeria. Latunde Odeku, like you rightly said, was the first black man to qualify as a neurosurgeon in the United States. And he was so patriotically driven that he came back to Nigeria to work at the UCH London. As far back as 1965-66, Latunde Odeku was already treating brain aneurysms. He was able to conduct highly specialized investigations such as cerebral angiograms, highly specialized investigations to diagnose problems that have to do with blood circulation in the brain. He was able to pick out aneurysm, he was able to pick out AVMs as far back as 1966 with decent angiograms. He went further and operated on some of these patients and made fantastic results. Then what has happened? What has happened is that the speed, the pace with which Latunde Odeku started the evangelism of neurosurgery in Nigeria has not, what is happening presently cannot justify that.
Yes.
We expected a lot more progress than we have made. Therefore, in terms of talking about training, he already started setting up the basic building blocks for producing neurosurgeons by the extent of the work he did at UCH Ibadan. Well, several generations of neurosurgeons at UCH Ibadan, they have done their bit. They have done their bit, to be honest. we have to give credit to University College Hospital London, because till tomorrow,
Ibadan,
Nigeria.
Yes.
Till tomorrow, they are producing highly trained, highly qualified, highly skilled neurosurgeons. But the numbers are infinitesimal compared to the needs of the Nigerian expanding population. The training of neurosurgeons have also expanded from UCH Ibadan to other teaching hospitals. Lagos University Teaching Hospital in the southwest there. Obafemi Awolowo University Ife in the southwest there. University of Ilorin in the southwest there. But now, coming towards the southeast, University of Nigeria Teaching Hospital, Enugu, Enugu University of Port Harcourt, Enugu State University of Science and Technology, Nnamdi Azikiwe University, Oka. Now, coming back to the North Central, recently, the National Hospital Abuja has been positioned and empowered to do such. And I'm happy to report the progress that we have made at National Hospital. In less than 10 years that we started pushing for contemporary practice of neurosurgery, we presently have accreditation with both the National Postgraduate Medical College of Nigeria and also the West African College of Surgeons to produce specialist neurosurgeons. Full accreditation and then we have also produced up to 10 neurosurgeons in the past 10 years.
In the past 10 years?
Yes. Now,
amazing.
Going further north, ABU Teaching Hospital Zaria is the same, they are contemporaries with UCH Ibadan. They have also done their own bit, having enjoyed different levels of accreditation. Some centers don't have full accreditation to train, but they liaise, they collaborate with other centers that have full accreditation.
Okay.
For instance, I am aware that we receive a lot of supernumerary trainees from UCH, from ABU Teaching Hospital at the National. They complete their training at National and they become specialists. Going further north, Udud Sokoto in the northwest, has been Professor Bibi Shehu has done a fantastic job there, setting up a world-class neurosurgery service center and also got accreditation status on both national and West African college to produce, and they produce generations of neurosurgeons that have spread all over the country to propagate the evangelism. Now, going towards the northeast, University of Maiduguri Teaching Hospital, and of course, I will not forget Jos University Teaching Hospital. So there is a geographical spread of training institutions where generations of Nigerian neurosurgeons have contributed to produce, to process young doctors in training. Now let me go to the issue of why the numbers are small.
Yes.
Apart from the fact that most doctors, the training in neurosurgery is tough and it requires spending so many years training. It requires so many years of training. And
how many years in comparison to the other specialties for neurosurgery and the others?
Well, for neurosurgery, if you're very lucky and fast, you might just make it in 6 years. But not very few people are that smart, and there are other issues that will prolong the training. So most people do it in 8 years, 10 years. But some other specialties, if you're very quick, if you're very lucky, you can get it done in 4 or 5 years. Right. So, but apart from that, the training demands, they are tough. They are tough because looking after brain and spine patients, they are really, really physically exhausting, mentally exhausting, and requires a lot of demand and commitment and passion. So not many doctors will have that resilience to go through that sort of rigorous training. Yes.
Are there, let's say, things that can be done to encourage resident doctors to actually venture into that field?
Well, the most frustrating part of the training is that the training environment is not ideal.
But we can say that for other specialties too.
The training environment is not ideal, that's one. If the training environment is not ideal, the practice environment is equally
Not ideal.
One of the reasons why the young doctors decide to port and translocate their service abroad is not only because of funds, it's because of equipment to practice to your satisfaction. Let me use myself for instance. My first 5 years in neurosurgery was at the UCH London, and the training and practice environment made a lot of impact on me. And my hope was that coming back to work in Nigeria, we'll be able to take our practice to that level. Let me give credit to the management of National Hospital. Part of the reason why I stayed back is because National Hospital practice environment is not ideal, but is a lot better than most of the other centers in Nigeria. And it is near the standard I was used to.
Near international standards.
Yes. So, what that means is that it is doable.
Yeah.
We could enable the environment and get younger doctors to stay and work here.
About the role of the senior colleagues.
Yes.
Creating an enabling environment for the younger.
Yes, I get what you mean. Their roles are very limited. The only thing they can do is to encourage the younger ones and make themselves available for teaching. But the senior colleagues do not lack the capacity to enable the teaching and learning environment. For instance, you're not going to teach someone how to remove a brain tumor in a classroom. That exchange of knowledge and skills must happen in an enabled theater. To successfully operate on the human brain, on the international scale, the minimum equipment requirements include, but not limited to, a neural navigation system. Is a computer-assisted access to the human brain that will improve precision. From the skin incision to removal of bone flap and localizing of the tumor, you've got to be guided by a computer. Irrespective of your knowledge and depth of understanding of raw anatomical data, you still need guidance. And that is one of the minimum standards. You need an operating microscope that will magnify everything you're seeing in there so that you will be able to separate the tumor from normal brain.
Assisted surgery now in full world and the Nigerian neurosurgeon. Have you been able to catch up to that?
Not obtainable in most of our hospitals, including those that are producing young neurosurgeons. And that is why most of them, as soon as they graduate and become specialist doctors, they plan to leave to fill up gaps in their training. But what we're asking for is for them to remember that they have more work back home than out there. In terms of the mandatory equipment to operate safely in the brain and spine of human beings, these equipments are not obtainable in most places, and that is the starting point. Now, you asked me about the role of the senior colleagues. The senior colleagues, their role is to make themselves available to teach. But creating the enabling environment goes beyond them.
So it goes to first on behalf of the federal government?
Now, we're now looking at the enabling policy trust, starting from the managers of this hospital. Because the managers of these hospitals must, first of all, agree mentally that these things should be put in place. Minimum things to put in place to produce a doctor that operates in the heart, a doctor that operates in the brain. They put it in their budget and they should send it to the Federal Ministry of Health for onward transmission to the National Assembly, where these funds are appropriated and released.
We talk about the managers of these hospitals, they are medical doctors, so one would think that they would understand the urgency.
Yes, most of them they do understand, but I'm not holding brief for anybody, but we're all aware that disbursement of funds often is a challenge. It's not all that they put in their budget that they get. So they have to work with what they get. That's where the issue lies. So we should be careful apportioning blames. I don't see there are no hospital managers like doctors who would not want to have the hospital function like UCH London, function like UCLA, but you got to work with the resources available to you. I'm not holding brief for anybody. Yes, but what I do know is that most hospitals in Nigeria are challenged with so much demand. When they get an allocation, it's not only surgery departments that they're going to spend money on. There is obstetrics and gynecology. In fact, the emphasis is on maternal and child health, primary health. So you're not going to be investing millions of dollars to buy an operating microscope just to treat a few people with brain tumors when you don't have vaccines to treat children. But I believe that if there's careful planning, all these should be in place. And if the government is able to isolate 1, 2, 3, 4 centers as national referral centers, these high-end equipment could be made available in those centers, and they form a referral center. As a matter of fact, such is happening on some scale at the national, because I do know that we receive a lot of referrals across the country. In North Central, the Southeast, Southwest, South, we do receive a lot of referrals. Up to the point that sometimes the referrals will overstretch our capacity.
Yes.
And that brings me to the point of emphasizing that there should be similar centers all over. It might not work in rural areas, but those rural areas will be within some catchment zone, like a catchment geopolitical zone. That's what I mean.
Okay.
So if we're able to empower, like University of Usman Danfodio University Teaching Hospital Sokoto, with modern contemporary equipment to practice brain and spine surgery safely, and all the referrals from that geopolitical zone will flood there.
Okay.
And then the doctors will also concentrate there, because doctors will follow equipment to enhance their functionality. So if we have such centers across the geopolitical zones in the country, it will reduce the burden and improve efficiency and outcome.
Let's talk about the burden, the existing neurosurgeons.
The burden is absolutely huge. And as a result of that, some patients are disenfranchised. They don't get the
So
chance.
there's collateral damages.
Yes, because if a patient will have to be on the waiting list with a brain tumor for upwards of 6 months before you get from the OR, the patient might die while waiting.
Yes.
Yes, because, and then again, in emergency cases like trauma to the head, trauma to the spine, if these facilities are overstretched, then the new ones coming in, there's nothing you can do about it. Let me give you an instance. At the National Hospital, you have close to 25 ICU beds. But Abuja population, as far as 2006 census, is definitely above 1 million people. But if you project the growth rate, annual growth rate from 2006 till now, you know that Abuja has a population of more than 6 million people. So I'm counting.
25 ICU beds.
Yes, 25 ICU beds.
For how many people?
That's what I'm telling you.
Wow.
So 25 ICU beds to take care of 6 million people, only Abuja. is a huge joke. It's a joke because someone who has suffered a traumatic brain injury is unconscious. He cannot even breathe on his own. He's supposed to be treated, managed on that ICU bed, the ventilator. Recently, as you are aware, courtesy of COVID, government is investing in hospitals around Abuja and all over the country to increase the capacity of ventilators. But for now, the new ventilators that are installing in those COVID centers, they are only reserved for COVID patients. Wow. Therefore, we are still stuck with our initial capacity to manage patients who need unconscious patients, head injuries, patients who are critically ill and all that. So we still have to rely on what we had before. And mind you, these are machines that can fail. So there will be downtime periods. So there's no time you're functioning at full capacity. That you have 25 ventilated beds doesn't mean they are all functioning all at the same time.
Let's talk about you personally. What it's been like practicing in Nigeria? How do you balance your social life and then the work, the family?
Once you choose a career in medicine, in general, then you have, under the Hippocratic oath, signed your life away for the comfort of humanity. That's one. Then when you choose to be a surgeon, you have further compromised your personal comforts for service to humanity. And then when you now choose neurosurgery specialty, you have just nailed it. You have decided to be on call every day. On call means that if you're called that someone is unconscious, he needs brain surgery, you just need to return your car.
You could be in the middle of a wedding and you get a call and you have to do.
Absolutely. You have to make sure the patient is sorted out. You know why? The brain is such a very sensitive organ that time is brain and brain is time. Every second counts. Yes, so the earlier you get into that brain and sort it out, the better for that patient. So, in terms of how we coped over the years, well, you need cooperation from your family, first of all. They need to understand that you're not placing the work ahead of their interest, that it's all about service to humanity. And you need an understanding family, and you must carry them along. Because you need them to stabilize you. The little time that you have to rest, they will give you maximum comfort. That's the mental programming and the carrying people with you along has helped a lot. They must understand what you're doing. Now, right from the word go, you must start training people. But you were trained. So the more people you train, there are different levels of training, from senior house officer to registrar, senior registrars. So by the time you have, like at the national now, we have trained up to, presently we have close to 6 senior registrars. Senior registrars are as good as consultants. Right? So they take off all the emergencies off you. I cannot personally, my level now, I cannot remember the last time I got called out in the middle of the night to take out blood clots in the head. Because we have been able to invest time, energy to produce competent senior registrars who will take that decision and they only brief you and you know that they're doing a fantastic job. But you must supervise what they're doing. You must know exactly the competence level of any senior registrar you're dedicating to carry out such a responsibility. You know what I mean? And the next day, you must go and review that patient and make sure that all. So producing a training in a training institution, doctors who are interested, who have the passion, you are training them at different levels. It helps to improve efficiency and reduce the stress. So you are only left with the elective cases. This patient has a brain tumor, is on my elective list. You schedule your elective list. So you know that every Wednesday I have a brain tumor to take out. Prepare yourself physically, mentally, spiritually, to get on the theater, get under the microscope, and dissect the tumor out of the brain without damaging the brain.
Any regrets so far?
No. My social life is compromised, but we take it as much as we can get, and try to leave weekend off work since I don't do emergency. I try not to do electives on Saturdays and Sundays. And of course, there's one aspect you also have to consider. If you're training people, you must be doing research. And if you're operating, you have to gather data. For instance, in this North Central zone, with the volume of work we have done at the national, so we are generating data that future generations of doctors will use to reference. For instance, we now have data on aneurysm surgery in Abuja, Nigeria. We have published in international journals. But most importantly, it will shape the future of neurosurgery in Nigeria. Because if we sort out the socio-economic issues in the country, now we need to move from general neurosurgery to subspecializations. Now, if you permit me, I would like to give you some information on subspecialization. The scenario that you created about the research recently published in US,
yes,
in California, it falls within the realm of neurophysiology. Yes, neurophysiology is studying the electrical activities in the brain and how that translates to making you who you are, making me who I am. Yes, so that's a subspecialty. We can't talk about subspecialty in Nigeria today because we are still grappling with general neurosurgery. We need to get hold of general neurosurgery before we can cruise into special subspecialties like neurophysiology, cruise into subspecialties like treating Parkinson's disease by just implanting electrodes in the brain to treat the movement disorder associated with Parkinson's disease. We need to move into specialties of using specialized surgeries.
How many years do you think it should take us to get to this that we're talking about?
It's not
based on this current growth pace.
It is just the determination and having the right mental attitude.
And if something changes.
Listen, I can tell you that Nigerian doctors are very brilliant. All they need,
of course,
is just an
we see them do well outside the country, so definitely.
Yes. We know that. So if we create an urban environment, we've got the numbers. Create an urban environment. Before I drop, I need to mention one thing. Major factor that is militating against the growth of neurosurgery. We are not doing even enough. Not because the environment, even the limited enabling environment that we have, we're still not using it enough. Because providing neurosurgical care is not cheap. The health insurance that we have in the country today, I repeat, and I want to emphasize it, the health insurance that we have, NHIS, does not and cannot cater for neurosurgical operations. Patients are made to pay out of pocket, which is not ideal. Neurosurgical operations, brain operations, spine operations, orthopedic operations, cardiac operations, they are not cheap. Someone's got to pay. The patient cannot pay. The NHIS does not have the capacity to get a CT scan for a patient that has knocked his head. So it's an area that we need to look into. These patients who need this, they cannot afford to pay out of pocket.
What particular government policy do you think, when enacted, will have a massive impact on neurosurgery in Nigeria?
The universal health insurance coverage.
Okay, just
is the
talk
key.
about the key to it, okay?
Our NHIS should be a mirror image of what is happening in the UK. NHS UK takes care of you from cradle to grave. Therefore, the government has to work out how to get people to contribute. The contribution to the national health insurance should not be limited only to people who are working in federal ministries, people who are in parastatals. What's that? What happens to the market women? We need to speak, and we need to speak up loud and clear that the NHIS we have today is not helping the people who really need to be helped. Government should work out how to get peasants to contribute from cradle to grave. It makes the job easy for us so that we don't worry about, has the patient paid for surgery? What is that? You see an unconscious patient, you're waiting to pay for surgery? Of course, the hospital providing us those services need the money to get consumables. They need the money to get drugs to treat the patient. So who pays? So we're looking forward to a more responsible national health insurance that will provide this care for patients. As a matter of fact, we need it for ourselves, me and you. Because you might find yourself in a place where you become an unknown patient. Nobody knows what's in your pocket. Nobody knows who you are. But you're rushed into an emergency because you have been involved in some crash. Nobody knows you. But you need to be alive for people to know who you are.
Yes, sir.
Not to come and identify your dead body. So we need this insurance to work. Whether you're from this rich class or from the poor class, it should work for everybody.
The question we always ask every guest here. So if today you meet the Minister of Health, we know there are several challenges in Nigeria's healthcare sector, but if today you meet the Minister of Health and you're meant to just take one action that will have a ripple effect on all other challenges, what action would you take?
If I have that opportunity, I'm going to focus on the national health insurance
I guess that's
and
much.
find a way to make it work.
Yes.
And let me emphasize again, what we have now is not national health insurance. In fact, what works for most of our patients is family insurance, church insurance,
Contributions from family members,
friends insurance.
families.
Those are the people that will gather when one of theirs is down to raise funds to help you. So, but we can make the national health insurance work. Whichever way that is the only thing I achieve as Minister for Health. So be it. Because if you have a national health insurance working that will provide care for sick people, then your job will only be to go and work out how you get that money off them. People will pay. You find a way to get them to pay. Because people have this money to pay, to contribute. But what we haven't been able to work out is how to get them to contribute this money. Make this care available to everybody. In fact, in the UK, where I trained and worked for several years, the only treatment you will not get in the UK, as at the time I left, was proton beam. Proton beam is a special treatment for cancer. That machine, as at the time, was only available somewhere in France. But every other treatment, except you choose to go abroad.
It's been mind-blowing talking with you.
Thank you very much.
Yes,
Thank you very much.
Thank you so much for joining our conversation. Until next time, this is the White Coat Report. Thank you for joining us.